Welcome to the Neurostimulation Podcast. I'm Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia in Vancouver, Canada. The Neurostimulation Podcast is all about exploring the world of neuroscience and clinical neurostimulation, how it works, what are the latest research breakthroughs, and importantly, how those breakthroughs are being translated into real-world treatments to help improve health and wellness. This podcast is separate from my clinical and academic roles and is part of my personal effort to bring neuroscience education to the general public, free of charge. Accordingly, I would like to emphasize that the information shared in this podcast is for educational purposes only and not intended as medical advice or a substitute for professional medical guidance. This episode is presented by ZipStim Neurostimulation. ZipStim is the neurostimulation clinic that I operate. You can find out more about our clinical neurostimulation programs at zipstim.com. That's zipstim.com. Today, I'm really looking forward to a discussion with Dr. Anne Truong. Dr. Truong is a physician with expertise in pain management, intimacy and sexual health, and longevity. Welcome back to the Neurostimulation Podcast. I'm really excited today to speak with Dr. Anne Truong. Dr. Truong is a physician with over 20 years of experience in various domains of medicine, including anti-aging, biologic cellular medicine, and intimate health. Dr. Truong is a best-selling author and international keynote speaker on these topics. And she really has earned a reputation as an innovative, engaging influencer who uses her global platform to teach healthcare professionals worldwide. Dr. Truong, thank you so much for joining us on the podcast today.
Thank you for having me here, Michael. I'm looking forward to some good discussions about sexual health and general health and overall.
That's great. Yeah. I'm really interested in hearing about your practice and particularly, as you just mentioned, your expertise around sexual health, intimate health, because it's such an important topic. And unfortunately, it's often overlooked when you go to your physician. It's often not something that the physician maybe even feels comfortable asking about. And so I'm really interested to hear from you in terms of your thoughts regarding that particular point and some other aspects of your expertise in that area.
So the reason why I specialize in sexual health is really more of self-interest. We're only interested in something, is it helpful to us? So when I was about mid-40s myself, I feel like I was older than my age and was not in my tip-top shape. And at the same time, my husband's also at the same age, and he had a heart condition that he required to take heart medication for. And unfortunately, heart medication is one of the main culprits of affecting sexual function. And he cannot take any type of ED medication, such as Viagra or Cialis, because it counteracts. And I wanted to help him in finding alternative ways to treat sexual dysfunction, because I'm personally affected by it. That's why I said self-interest. It started out with self-interest, and I dived deep into it and finding out, how do you treat the root cause of a problem? And I'm an allopathic doctor, so the way I was trained was medication and steroid and then surgery. But I realized over the years that I was really not helping my patient. I was just band-aiding the problem and not treating the root cause. And then I started learning about acupuncture. Prior to me discovering about alternative to sexual health treatment, I learned about acupuncture. And acupuncture really opened up my eyes on the body healing and how the body is interconnected. Our organs are interconnected as one. And with that knowledge, and I was already doing stem cell therapy, it was really a natural progression to dive into the root cause of sexual health. So that's how I got involved into it. And my husband was my first patient. I was my first patient, and we saw the benefits of what using a lifestyle modification and also using stem cell therapy to restore sexual health. And that's how we started our journey on that. And as I do this for a long time, we've been doing this for over 13 years, have treated over 7,000 men with ED and women too, and women with sexual dysfunction. But we've treated over 37,000 patients over 27 years span. With that, education is very important.
Mm.
Education is knowledge, because if you know why you do something to prevent or to help, it will actually motivate you to stay, to continue the course, right? And I feel that sexual health is the most widely understood subject, because it's embarrassing to talk about. There's a shame to it. It's dirty, and doctors don't talk about it as well because of how they feel about it themselves. And it's a psychosocial problem. It's not just a physical problem. And so oftentimes when you have a sexual dysfunction, it's almost like shameful to talk about it. So you just try to find information on your own through the internet. And as you and I both know, that the internet is not the most reliable source of information, even AI, all right? Even AI as well. You can ask ChatGPT or everything else, but AI will spit out some generic answers for you. But more than anything is really getting science-proven, research-based treatment that work. And believe it or not, restoring your sexual health, it's pretty straightforward. You just need to do the hard work. You just need to do the work and be focused and be consistent.
Yeah, that's great. No, that's super interesting because you're right. There's such a stigma around discussion of sexual health, and it's really unfortunate because I think that a lot of people are embarrassed to bring it up with their doctor, or as you say, they're not too sure how to go about getting help, and then relationships start to become affected. I think I see a lot of elderly people in my own practice, and I think there's an unnecessary kind of assumption that sexuality naturally declines after midlife, which is really unfortunate because I think that's one reason why a lot of relationships end up becoming more distant, because people do have these challenges and they're not sure where to go for help. So I'm interested, you mentioned a couple of things there in terms of approaches. There were the lifestyle factors and then the biologics. Do you mind explaining a little bit? And I imagine that this is all spelled out in detail in your book, Erectile Dysfunction Fix. So just for viewers and listeners, we're going to put links to all of Dr. Truong's content in the show notes. And I'd encourage people to read those, or at least access those links and read the book for sure. It looks very interesting. But yeah, what would be some key points in terms of the lifestyle factors and the biologics, Dr. Truong?
Honestly, like I was talking earlier, that restoring your sexual function is quite straightforward. All it is four things you need to do. Four things. All right. And I'm not talking about just sexual function, because good sexual health equals good general health, because everything that you're doing that will help with your sexual functioning is all the same thing. It's the same thing for your heart. It's all the same thing to control your diabetes. So when you do these things, it's also for heart health, also for diabetic health, and also for longevity. So you live longer, you actually will prevent cancer, will prevent Alzheimer's, and you will lose weight. So it's just not about sex. So the four pillars to maintain or restore sexual function is diet. So focusing on eating a clean diet. And I'm not talking about keto, anything like that. We usually recommend a Mediterranean diet. All that is that less processed food, focusing on vegetables, fruit, and lean meat. Lean meat is chicken, fish, and pork. Less red meat. That's it. I tell my patient, essentially eat what the earth grows for you. Whatever the earth grows for you, eat it. Don't eat anything in a box, in a can, or in a bag, in a plastic bag. Eat what the earth grows for you. Eat what our ancestors ate, right? Before the industrialized era, before we start boxing it in boxes and so forth. And so eat what the earth grows for you. And then number two, you'll be surprised when you eat what the food that the earth grows for us, you actually end up eating less.
Yeah.
When you eat less when you eat the food in its natural form. It's amazing. And then you don't have any cravings on top of that. You don't have craving for sweet. You don't have craving for cookies or anything. It's funny. Your body will say, your body is like a sponge. When you give it what it needs, it just say, "Oh, I'm good. I don't need to eat a cookie late at night. I don't need to eat a bag of chips late at night." And the body just say, "Thank you. I feel good." And number two is exercise. I know it sounds like an exercise, eat, but it's really moving your body. And to simplify things, just moving your body, whether that'll be walking up and down the stairs or walking outside or rowing or biking or something. Move your body. And all it takes about 30 minutes, 4 times a week, or equivalent about 150 minutes a week, because research has shown that movement that about 150 times a week is good for the heart. But every time you exercise, your heart pumps better, and
Mhm.
when it pumps, it also expands your blood vessels. And when your blood vessel expand, that's also good for blood flow. Okay. And you should exercise at a level where if you're moving, it's a little hard to count 1 to 10, where you should be like that. So you shouldn't be comfortable in just counting 1 to 10. What I tell my patients is go outside walking. You don't need to belong to a gym or anything, and shoot for about an 18, 20-minute mile, and go for a mile and then go for 3 miles, whatever suit you. So
Mhm.
that's exercise. And then number three is sleep, making
Mhm.
sure that you have adequate sleep, at least 7 hours of good sleep. Sleep is important for the body to heal physically and mentally. We take sleep for granted because we never have to think about it. But when you don't sleep as well, you're just not in tip top shape the following day.
Yeah.
So because your body needs to heal, and that's when your body start to get rid of the toxic stuff that you have in your body, and it start to heal the remaining tissue. And then the fourth pillar is decreased stress or stress management. So
Mhm.
what that means is I'm not talking about going to a yoga studio and doing all this and that. I'm just really talking about decreased distraction, decrease negative stuff in your life.
Yeah.
Because we live in a world of smartphone and multitasking and all that, where it's really down, making down to the basic stuff of maybe in the morning, maybe don't grab for your phone right away, and meditate about 10 minutes a day. And that just means, when I say meditation, it's just closing your eyes, using an eye mask to cover your eyes, because when you put an eye mask on, it actually decreased 30% of the input that goes to your brain. And when you
Mm.
decrease your eye, it's 30% of the input. It's
Mm.
literally will slow down your brain right away. Just try it. Anyone that I never tried meditation or have a trouble sleeping, put an eye mask on, and you'll
Mm.
be amazed how your brain slows down immediately. I
Mm.
do that every time I take a nap in the daytime. If I feel like my brain is slowing down, I will put an eye mask on, and literally within 5 minutes, I'm asleep. And even in just like a 10, 15-minute nap, I wake up refreshed. I wake up like I just like exercise for a whole hour. So sleep is important, and but then the eye mask will also help with the meditation. And the other thing is breathing, slowing down. Oftentimes when we breathe, we're mouth breathers. When we're stressed, we're mouth breathers, and we take shallow breath in order to give your body peace and not put it in a stressful state, is to breathe through your nose, like
Mm.
for a count of four, hold it for a count of four, and breathe out to your nose to the count of four, and then hold it for a count of four, and then breathe in. So it's called the box breathing technique. What that
Mhm.
does is essentially slowing down your breathing, helping ensure that you take deeper breath in your lungs. And so that when you take deeper breath in your lungs, you get more oxygen exchange, and then the carbon dioxide leave the lungs, go out to your nose. And the reason why I say nose is because the nasal passages here have a lot of the nerve ending and a lot of the circulation that will actually help you make more nitric oxide. Nitric oxide open up blood vessels. So that's why nose breathing is important. Now, you can do mouth breathing too. It's just that you get more nitrous oxide production to your nose. And
Mhm.
I don't know if you notice, but if you're stressed or you're focused or you're something, you don't take deep breath. We don't take deep breath. We're mouth breather now than we ever been
Yeah.
as well. So nose breathing is important, and slowing down your breathing. Just taking deep breath and just slowing down your breathing goes a long way as in lowering stress. And that's all really all it is about the things that you need to do. It's
Mhm.
not, you don't need to join a yoga studio. You don't need to travel to India to go to some retreat. You hear about this all the time, but it's really actually more simple than we think it is.
Yeah, no, that's great. I appreciate hearing that summary. The breathing and the nose breathing in particular is quite interesting. It's easy to just try and implement these lifestyle hacks. And I read James Nestor's book Breath a few years ago, and I've started
Yeah.
doing mouth taping at night. And initially it was a bit difficult to get used to, but now I do it almost all the time. And so I force myself to nose breathe during sleep. My sleep has really improved. And now, even if I don't put the tape on, my tendency is to just nose breathe. At least it feels like when I'm falling asleep, and who knows when I'm actually asleep. But yeah, and the nose breathing, I think, is a really key point. And I really appreciate how you explained the importance in terms of the nitric oxide and how that opens the blood vessels. It sounds like just paying attention to vascular blood vessel health is a really key unifying principle in terms of all those lifestyle factors. And it makes sense because healthy sexuality in terms of the physiology is really dependent on healthy vascular blood vessel system health.
Absolutely. So it's just not about sex. It's really about general health and longevity. And I want to bring up this point that in the end, it's about sex because the sexual center in the brain is deep in our brain, in the most primitive brain center of our brain, the sexual functioning. And it's the most protected area because it's deep in our brain. And we share that same brain function, and they're as salamanders who are millions of years old because it is an integral part of who we are as human beings. Because you have to think about it, as human being, it is our job. What is our job? Our job is to continue the human line. Our job is to carry the DNA so the human line can continue. So that is an integral part of us as a driver of us as a human being. And before we started recording, we were talking about why sexual activity is dirty, and the sexual connotation of the anatomical part of the sexual organ is dirty and it's prohibited. Even on social media in 2026, you can't even say that word on Google or even on YouTube. Sometimes I get censored to talk about certain terms, but I'm not talking about the actual part of lovemaking. I'm talking about the medical benefit, and I have to name the term, but still I'm censored. So the point I'm trying to make is that it shouldn't be dirty. It's an integral part of who we are because it is an integral part of us as human beings to have sexual relations. It's built in our DNA, built in the deepest part of our brain to do that, and to suppress it and to not talk about it. It really gonna affect who we are as a person. But unfortunately, that's where we are now, and that's one of my job is to my passion is to bring it out of the closet, to make it from being shameful, dirty, and bad, to bring it out into mainstream, and let's talk about it. What we did with mental health,
Yeah, for sure.
when people with mental health, because all of us, you, I, everyone, we will have sexual decline as we get older. But we don't have to live with it if we know what we need to do. But how do we know we need to do unless we talk about it? Unless it becomes non-shameful to talk about it, right? And doctors are not even comfortable in talking about, and they're not trained on it, and so it becomes a double negative where the patient is afraid to bring it up because it's uncomfortable, it's shameful, and then the doctor is uncomfortable in discussing it, so nobody is discussing it, and then you're just left on your own, and sometimes you just like live with it or end up taking an ED medication. So I want to, what we need to do is to bring it to mainstream and just have open discussion about it and not shameful, because we will have sexual dysfunction because as we get older, why is that? Sexual dysfunction is related to high blood pressure, high cholesterol, diabetes, stress, obesity, sleep, smoking, porn, all those bad lifestyle. It's related to that. So what happened when we get older? We don't exercise as much. We gain weight. We have more stress, and we get older. Family, life, finance, a lot of stuff, right? And then we may not sleep as well. We may not eat as well because maybe we're traveling a lot. We're not able to control what we eat. So you get all these factors that play with life as you get older that predispose you to having sexual dysfunction, right?
Mhm.
Because sexual dysfunction doesn't happen in on its own.
Right.
It's happened because of, like I said earlier, high blood pressure, high cholesterol, diabetes, obesity, stress, sleep, porn, and all that plays a big role into trauma. Trauma is
Mhm.
part of stress. Trauma, any type of trauma, plays a role into that as well. So we should treat the root cause of that rather than treating the symptoms of sexual dysfunction. But sexual dysfunction will happen to all of us. It happened to me. It happened to my husband. It happened to a lot of my friends, but we don't talk about it. And when I do talk about it, it's uncomfortable and nobody wants to talk about it because it's personal, right? It becomes personal thinking because somebody will think that you're less of a person and you're dirty and that you're I have had friends that had distanced themselves from me because of what I do because they think it is shameful.
Yeah, that's unfortunate, and good for you for advocating and educating. I think that's the key issue. It's really important when you mentioned the connection with these deep ancient brain areas like the hypothalamus that are really involved with these primal drives like hunger and sexuality, because I think that it makes a lot of sense that because it's such a foundational kind of instinct from an evolutionary perspective, that the more that people can have a healthy integration of these kinds of drives, then probably the more healthy that's going to be for their psychology and also for their relationships as well, at least their intimate relationship. And so I think it really makes sense from the perspective of general wellness that people have the opportunity to just understand as much as they can about this and to try and have optimal health in terms of their sexuality and their relationship. So yeah, I really think it's so important.
Yeah, and thank you for giving me the opportunity on your show to discuss about this openly and also to let people know that it's not shameful, it's not you. And if you do have it, there are solutions. And all of us will have it. We
Mhm.
will have
Yeah.
it. And it's not shameful. There's nothing you did wrong. You
Mm.
just didn't know what you needed to do. But now you know what you need to do, then you will do it. Because when we know why we do certain things, then we will more motivated to stick with it. So I think that my goal is to have an open discussion about it and to share the knowledge. And like I said, everything that I mentioned, diet, the exercise, and sleep and stress doesn't cost you any more money than you
Mm.
are spending now because you're paying money for your food anyway. Might
Yeah.
as well make good choices with that. You're gonna exercise. You don't have to join a gym. You can go outside. My kids
Hmm.
say the air is free, the earth is free, and
That's
no
right.
one's gonna stop you from going walking outside. And when you're walking outside, you can practice nose breathing, you can
Mhm.
practice box breathing, right? And in fact, studies have shown that when you go exercise outside in nature, it actually very beneficial for stress reduction as well. It's like
Mm.
almost like connecting with Mother Nature
Right.
because we are Mother Nature are connected. And so you do a double check box and okay, my exercise and my meditation, my stress reduction box is checked because I'm doing outside. During COVID, that's what I did a lot. I walked outside a lot. I
Mhm.
walked 3 miles, 5 miles at a time, and I listened to podcasts. That's how I got into podcasts as well, and it was very therapeutic for me. It was a stressful time for all of us as well. It's really quite simple. In fact, the more I talk about it, the more I'm like, all of us can do it, but we didn't.
Mhm.
I love this phrase. It says, "You don't know what you don't know."
Yeah.
You don't know what you don't know until somebody tells you otherwise, and then you go, "Yeah, that makes sense."
Exactly. Yeah, for sure. I'm interested in the connection between the sexual health and the anti-aging in the longevity, because obviously with attention to vascular blood vessel health, I can see how that connection is there. But in particular, I think myself and many people are not entirely familiar with the term biologics. So do you mind breaking it down for us and explaining how biologics relate to sexual health and other things that you have expertise in, like pain management and aesthetics and longevity?
So essentially, biologic is you using your own cells in your body to help you heal. And believe it or not, we have stem cells in our body that is readily there to help us heal. For instance, if you cut yourself, the other day I was slicing some carrot and I cut my finger. And so when you cut yourself, what happens? Blood goes to the area, right? And then it gets clotted up. The cells in your body that help with clotting is called platelets. Those are the cells that help clot it up. And when it's clotted up, what happens? Other cells in your body come and repair that cut, and it looks like a scar. And then over time, that scar disappears. That's healing. That's stem cell working right there. You have those stem cells in your body, and they're made in the bone marrow. Your blood cell, your white blood cells, and your platelets are all made in the bone marrow. So what we do, the biologic is essentially using your own cell to help you heal. That's what biologic is. And the biologic could be, the material can be the bone marrow and like the stem cell from the bone marrow or the stem cell from your fat. Your fat also have healing cells called that. And then the platelets is what in your blood that's circulating around, all right? 5 liters of your blood. And how we do it is that we extract out the platelets and from your blood, it's essentially just going to, as if you do a blood work. You go to the lab and they draw a blood to check your cholesterol level. We draw out a much higher, a larger amount, like from 60 cc to about 240 cc of blood. And we would isolate out only the platelets. The platelets comprises about 1% of your blood, only 1%. So we would throw away the red blood cells. We keep a little bit of the white blood cell and we keep the platelets, and then that's injected into the organ that is not functioning well. So for men with ED, that will be the penis. For women, that will be the vulva. But we can do the same thing for pain, like a knee pain, you have knee pain, or when you have hip pain or ankle pain, you can do that. We can even put that in the hair to help hair regrow. Put that in your skin and your face to help with wrinkles and to help rejuvenate skin. That's what I get on my face every year. I get the platelets on my face every year. And so you can put it anywhere that has a dysfunction. And so that's how we use the biologic to boost the healing. So I almost said push the reset button.
Thank you very much, Dr. Truong, for a very interesting discussion. I really appreciate you sharing your expertise, and in particular, the lifestyle factors that I think viewers and listeners will really be able to easily implement into their daily routine in order to help optimize their sexual health, their blood vessel health, in the interest of general health and wellness and longevity. So thank you very much once again. Again, viewers and listeners, I really would encourage you to check out Dr. Truong's content. I'm going to put links in the show notes. And I think it's going to be very valuable for you to increase your understanding and awareness of these very important areas. And have a look at Dr. Truong's book, and it'll give you an opportunity to really take advantage of her expertise in order to improve your understanding and awareness of these important health and wellness factors. So thanks again.